This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hey everyone, welcome back to the Beat Podcast, recorded here at Vive in Nashville, Tennessee. I've got the privilege of hosting Pranam Ben today. He's the founder and CEO of The Garage. He's a visionary leader and entrepreneur with 25 years of transformative experience in healthcare informatics. Thanks for joining us, Pranam.
Thank you, Sal. It's a pleasure to be here.
Yeah. How's the meeting going for you so far? How was day one?
It's always a great experience to come to Vive, the networking, the learning, you share experiences, and there's a ton of information that you collect that refines your strategy for the rest of the year. So it's always great to come to Vive.
Love that. Love to hear it. Okay, so let's dig in. How is your organization helping to drive change in healthcare?
We started this journey on April 1, 2012, when that was the time during the early movement of the shift towards value-based care. And back then we realized that value-based care is going to be the answer to many things that are broken in healthcare. It is not going to fix the system, but it's going to help us make a lot of progress in the areas that were hurting us. So we doubled down back then and said that this is going to be our focus, and we are going to be the platform that empowers that transformation to value-based care. Since then, it's been a relentless focus for us, an amazing journey, great partnerships. We built a great team that is supporting the mission, and very, very proud of the work that we've done to date.
Congratulations. That's really great to hear. And I agree, value-based care is what we need to improve outcomes and decrease costs. We need to do both.
True.
What does a digital-first, data-first approach look like in practice, and how does it contribute to achieving the quintuple aim?
That's a great question, Sal. We didn't accidentally envision, hey, let's do something cool and do everything digitized, right? We actually arrived at it based on years of work that we put in with the providers and other constituents that we partnered with in this journey. We realized that value-based care required a whole new approach, a different architecture to enable that level of access and affordability of care, which is a big problem with fee-for-service models. So this notion of saying, hey, we want to be digital first, data first, and if you kind of envision the architecture, we distanced ourselves. So the architecture, the DFDF concept, which is digital first, data first, is not tied to our platform or the garage in itself. It's more of a view of what the entire sector needs to scale value-based care and democratize access to care. Mm-hmm. So it starts with this idea that you want to have a data layer that is an aggregated, normalized view of all forms of data, not just mainstream data, including social, lifestyle, and genetic, that will then give you the most accurate, comprehensive version of the truth in regards to the patient's health. And then you have the platform that sits on top of that normalized data warehouse that functions as a command center, as an inclusive hub. On top of the platform, you have our perspective, which we call tiny, tasty morsels, which is you can't take the complexity of the data and the workflows and just make that accessible in raw to the end users and the stakeholders. You have to convert that into something that's actionable, meaningful, rich, and simple. That layer in our world is called tasty morsels. So on top of the tasty morsels, you have a digital front door. So all the stakeholders, regardless of their role and privilege, they come in through one common entry point, which is the digital front door. Even the human experiences, the offline experiences are orchestrated with this DFDF architecture. So It's digital first, data first. It's platform based. It's AI powered because you have to leverage the potential of AI. But at the end of the day, everything is human centric. Healthcare was, is, and will always be human centric. So that's how we've anchored the entire platform on this DFDF architecture. And that's our vision for the foreseeable future.
Yeah, that's really, really great. It sounds like a great platform and a great solution to enable value-based care. What emerging trends and technologies have you seen here or are you seeing lately that you think is going to change healthcare for the next 5 years?
The next 5 years, I think there's two major technological breakthroughs that I'm personally very excited about. That's where we are investing as a company. One is driving more intelligence out of data using highly defined machine learning and natural language processing technologies. I think there's a lot of opportunity with the data that is available today that previously, even pre-pandemic, was not available in healthcare, right? So how do you drive intelligence out of the data? How do you contextualize the data? And how do you normalize the data and prepare the data in a way that's actionable? So there's a ton of that stack is very rich, very mature. And we are heavily invested in that area to create that contextualized data at scale. So that's one aspect of the technology stack. The other aspect is the front end, as it relates to the end user experience. This is where you look at Gen AI, you look at simplified, fluid experiences where this notion of drill and discover, which is traditional Web 2.0 systems, is now being transformed into more interactive, simplified conversational experiences. So that's where the idea of a copilot comes into play. So we are looking at copilot as that condensed, simplified, personalized, interactive experience, regardless of who the stakeholder is. It could be a clinician, it could be the patient, it could be a care manager, it could be an administrator, whoever the stakeholder is, to create that copilot everywhere on the front end and a highly defined machine language intelligent backend. So those are the two major domains that I see helping us scale the DFDF architecture and basically transforming system architectures that exist today.
Oh, that's fantastic. Thanks for sharing how you guys are leveraging these technologies for both the front and back end.
Yep.
Just activating both with this is fascinating. Can you share some real-world examples where organizations have successfully implemented the DFDF approach, digital first, data first approach, and the measurable impact it had on the 5 aims?
There are many, sir. This is our world. We are grounded in the realities of the work we do and the impact the work has. It's not so much about what the technology is. What's more important is what the technology does. So right from ACOs, the ACOs that we are partnered with, driving the highest per patient savings index in the country by adopting this architecture. That's validated by the $1 billion that we have saved partnering with ACOs to the Medicaid Trust Fund over the last 7 years. That's one example. Quality scores regardless of the alternate payment model that you're participating in, because that's a very difficult strategy to enable if you're not data first, because quality scores can go all over the place. And in many cases, they can be misleading if the data is incomplete. So to take the data first approach and ensure that you're able to normalize and create a horizontal quality management strategy is a great example. And all our programs are 90% plus in terms of their quality scores. That drives your bonus payments, drives better premiums on your contracts, and all the good things that come with it. Even some low-level examples, like we helped a group out of Pennsylvania identify millions of dollars in fraud and abuse due to DME billing, and they were able to take that up with CMS and get their savings adjusted for that. That was because of data. Another group in New York found additional bonus payments from a commercial payer because of data that the payer had not harnessed for the provider's performance scoring. So our platform caught that. We became a platform to catch that gap and highlight it, bring it to the attention so they could then reconcile that, negotiate that back with the payer, and they received hundreds of thousands of dollars in additional bonus. So I can keep going on and on. We have an FQHC group that increased their Medicaid recertification rates with the data first approach. So one of the things that when we say digital first, data first, you shouldn't forget the digital first aspect of it, right? So the data first will tell you what you need to do. The digital first will give you the tools to act on it. That's the reason they go together. You can't say data first only or digital first only.
Right.
They have to go together. So in each of the examples I mentioned, not only did we call out those opportunities, we also gave them the tools to act on it, whether it's patient engagement, whether it is provider communication, whatever be the tool that they needed to act on it, that was enabled as well. And that's how the DFDF architecture brings in real change in a very wide spectrum of use cases.
Thank you for that. Yeah, it sounds very useful. And what would you say, if you had to sum it up, the biggest pain point your organization helps solve for these providers looking to deliver on value-based care?
I think if you look at the greatest advantage of a platform like ours is that we bring it all together. Previously, you didn't have a system that would make sense of what happened with your patients when they were not in front of you. The EMR does a great job in documenting and being a reflection of what you did when the patient was in front of you. But when the patient walks out of your door, you have no idea what's happening with the patient in their community. They're going through their daily habits, they live their lives, and they're dealing with things that cause events that require treatments. The way we look at our platform is we kick in when the patient walks out of your door. So you keep a pulse with the patient even when they don't have an articulated need. And in that, I think, is the most powerful way to create a digital first, data first system that will reduce the burden we have on the entire healthcare system, which is driving shortage of talent, burnout, inequities, you name it. So if you think about the quintuple aim, all the 5 aims are best served with a DFDF architecture that normalizes data, that is inclusive in the way it integrates workflows, and basically, like I said, brings everything together.
That's great. We've talked a lot about digital first, data first strategy. What have you seen are the biggest challenges healthcare organizations might face when they try to transition to this strategy? And how can they overcome these obstacles to drive better outcomes for patients and care providers?
I think the number one in the 12 plus years that we've been doing this, the most important factor in driving the transformation is the culture. Are you as an organization willing to adapt and change your core culture? Because value-based care basically is a redefinition, a reimagination of something that was status quo for decades. So to enable that change, that behavioral change, you have to change your core culture. You have to adapt your core culture. So that's the first point I would say, that value-based care is a cultural thing. 2, governance, right? How do you govern? This cannot be something, it cannot be an experiment. It cannot be a trial and error. It is real today. It is mainstream today. 60% of the reimbursements today in 2024 had a value-based modifier baked in. So it is not an option if you're, regardless of what type of provider you are, what size, what specialty, it doesn't matter. The realities of value-based care are things that you are dealing with. So the governance around the program is extremely critical. And data availability was a big problem pre-pandemic. I think we've come a long way, and kudos to CMS and all the agencies that worked in advancing interoperability with FHIR and some of their new standards and with what's promising from TEFCA. Very excited about that. But it's one thing to make data available. It's a whole different ballgame to make data contextual and actionable, because there's a lot of junk in the data that we have today. Cleansing the data, preparing the data, contextualizing it. So that's a lot of the work that we do. So I would say those are the 3 big challenges, that culture and that mind shift, that governance that you need to put around this, and the commitment that comes with it. And third is putting the data to action, leveraging state-of-the-art technologies, including AI. Because what you don't want is to take a technology-first approach and say, there's a lot of hype about AI, so I'm going to adopt AI because others are doing it. We have this posture that the A in AI stands for applied. What's applied is intelligent. So if you have a use case where we can apply machine learning, natural language processing, whatever be the AI technologies, Gen AI, and that drives better outcomes, whether it's patient, provider, or systemic outcomes, that becomes the most real world use case of AI adoption for us.
Yeah, that's fantastic. That was a really valuable outline that you've given us a good frame of mind to approach this with. So thank you so much for that.
Thank you so much.
Pranam, what would you give us as a closing thought on this topic? And if people want to learn more about the Garage and the work that you guys do, how can they reach out?
Yeah, we have a presence on all social outlets. We have a website, thegarage.health. We have a presence out there. I think it's very easy to connect with us. It's easy to track the work that we're doing. All the impact that we have had, the case studies, the storylines are published publicly, so people can vet us out there. And we are extremely proud of the work that we do. For us, the focus is scale. How can we increase the density? How can we forge new partnerships and drive more collective impact and help the entire industry move closer to that quintuple aim, which is our collective North Star. And in general, my message would be, I feel we have a finite bandwidth. If we have a window, we have a 5-year window to basically fundamentally transform the system of care, because we've gotten too top heavy. We've gotten to the point where the realities of providing care to the deserving communities and patients is getting harder by the day. From my point of view, I have a 5-year window to bring in real change. And you have an amazing program in value-based care that started its journey early 2012. So we are 13 years into it, has driven a lot of good outcomes in different parts of the country for different provider types. So use that as your stepping stone to drive more intensity and be bold in that approach. With, like I said, with a digital first, data first architecture, that commitment from all the constituents and stakeholders in the ecosystem. Be bold, drive that digital first, data first architecture at scale, and provide a more affordable, value-driven experience to every patient in this country.
Well said, Pranam, and a great way to close out our session today. Really appreciate you joining us. And for everybody listening, make sure you check out the show notes. You'll find all the ways to get in touch with Pranam and his team at The Garage. All the case studies that he mentioned and everything that you need to potentially work with them, it's all there available for you. So Pranam, thank you so much for joining us today. This was a lot of fun.
Sal, thank you so much for having me. Appreciate it.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.